Okay.
You have a lady with secondary hyperparathyroidism. What's the pathophysiology of hyperparathyroidism in CKD?
Okay, patient have an CKD will have a renal failure, so have an abnormality in renal tubular absorption of phosphate, which will lead to hyperphosphatemia. And also there will be a decrease in production of 125 hydroxycholocalciferol vitamin D, which will lead to hypocalcemia. And both of them will lead to the increase in parathyroid hormone secretion, which will lead to secondary hyperparathyroidism.
Well done. That's really good. In parathyroidectomy, what test to do to identify the parathyroid tissue intraoperatively?
Frozen section.
Yeah. Can you explain to me what is frozen section?
The surgeon need to take a sample from the tissue, and after that send it to the pathology unit. The pathologist need to freeze this sample, and after that section it and cut it, and after that it will be stained and seen under microscope. And after that, the report of this tissue will be immediately done.
Yeah, so you wanna say how it's done basically. So you get a surgical specimen, you put it on a metal disc or a metal tissue disc, which is then secured and frozen immediately to minus 20 degrees. You put up a shell-like material called an OCT. It's polyethylene glycerol and polyvinyl alcohol. Subsequently, it's cut, frozen with a microtome into small portions, and then you look under the microscope and you stain it by a hematixylene and AUC stain. Okay, what is the genitourinary complications of renal stones?
Okay, either there will be multiple complications, either infection, which will lead to pyelonephritis, could be also obstruction, which will lead to renal failure, and formation of renal cell carcinoma due to repetitive irritation, also fistula formation, and could be a rupture.
Okay, so you want to classify it into obstructive features and infective features and long-term or chronic features such as the carcinoma. All right, how stones can cause cancer?
Okay, the stone firstly will lead to the infection and irritation. I don't remember.
So anything that can cause chronic inflammatory process in the body can lead to cancer, right? So it's basically based on chronic inflammatory process and chronic irritation, all right? This will induce the DNA damage, okay? The DNA damage in the proliferating cell and their generation on reactive oxygen and nitrogen species, normally to fight infection, and then repeated tissue damage with repeated DNA damage and DNA repair leads to production of new cells and causing basically cancer, usually squamous cell carcinoma. What is the most common type of cancer in the renal pelvis?
Okay, transition cell carcinoma.
All right, so renal pelvis transition cell carcinoma, that's right. What is the most type of cancer in the kidney?
It's a clear cell carcinoma.
We say again?
Clear cell carcinoma.
That's right. It's renal cell carcinoma, and the subtype is the clear cell carcinoma. That's right. And what to look for in a histopathology report from a removed kidney when you're suspecting renal cell carcinoma?
Okay, we need to see a microscopic feature. The macroscopic feature, we need to know. Okay, the shape and the color, and if there is any area of prominent cyst. Am I right?
Well, I'm not going to answer if you're right or not. You just need to answer the question.
Okay, and okay, in macroscopic feature, as I said, we need to know the color and also the next. 。  . 。 。 . 。 . 。 . 。 . 。 . 。 . 。 . 。 . 。 . 。 . 。 . 。 。 . 。 . 。 . 。 。 。 . 。 。 . 。 。 . 。 。 . 。 。 。 . 。 。 . 。 . 。 . 。 Is
I,
it in
I,
that
I
one?
like I like the fact that you classified it. So you want to look at the gross picture and the microscopic picture. You want to look at the
Yeah.
tumor size, the appearance of the tumor, presence of ulceration, presence of necrosis, and the location of the tumor, whether it's the cortex or the medulla, and also the invasion of the surrounding structures. Microscopics, you want to look at the anaplasia, the differentiation, depth of invasion, and whether there is the margin resection as well. You have postal margin node and also the lymph nodes. Okay, so you want to always classify gross pictures and microscopic picture, and this is a generic answer, right? So the gross picture, you're always commenting on the tumor size, shape, surrounding structures, the local and surrounding invasion, and presence of necrosis, presence of ulceration. And the microscopic features, you're also looking at the histological grade and also the anaplasia and the differentiation as well. All right. Okay. Thank you very much.